Welcome to the RD2BE podcast. Each week we sit down with a different registered dietitian nutritionist to showcase the diversity of opportunity in the dietetics profession. Our aim is to dismantle the notion that there is a traditional career path. I'm Carl Barnes, the registered dietitian behind the scenes of RD2BE.
And I am Jenna Warnock, the RD2BE host. Our RD guests share their stories, career paths, and advice to help students like us succeed in the profession. This episode is part of our mini-series featuring the Accreditation Council for Education in Nutrition and Dietetics, otherwise known as ACEND. We are creating this series to clear up common confusion and misconceptions about ACEND and its relation to the Academy of Nutrition and Dietetics, as well as the Commission on Dietetic Registration. We're also in a super transformative phase of dietetics with a new master's degree requirement, dietetics application process, and ACEND also created some new advanced practice doctoral standards where understanding these topics are crucial for pushing our profession forward. Join our conversation with Dr. Rayane AbuSabha. She's the Executive Director of ACEND, and in this series, we're going to discuss what ACEND is, their new standards, and what steps you can take to uplift and advocate for our profession with these standards. Welcome back to another week of the RD2BE podcast. I'm your host, Jenna, and we are continuing yet again to just keep talking about these hot topics in dietetics right now. We're with Dr. Rayane AbuSabha again we've gone over so many other conversations, just going over what ACEND is, the dietetics application process, the master's degree transition, job opportunities, salaries, advanced practice doctoral standards. And so now we're kind of going into more soft topics, we've talked about some more hard fact knowledge about just wanting to make sure everything's understood about what is the current up-to-date things to know about becoming a dietitian. But now, as we've had these conversations, we want to explore more into those soft skills and those soft things that we don't want aspiring dietitians to forget. And one that Dr. AbuSabha mentioned is professionalism. And so we've seen with, the pandemic and with COVID, things moving virtual, that's just created a fundamental shift in what professionalism was pre and post pandemic. But that doesn't mean that it's any less important. And Dr. AbuSabha mentioned it being something that is really important in the profession, especially today. And I'm super excited to hear her insights because she hires a bunch of people. She has a bunch of people that work under her. She's heard stories and really excited to hear her perspective on the topic. And so we again are featuring Dr. Rayane AbuSabha, who's the Executive Director of ACEND. We have plenty of wonderful episodes with her and another one to come. Just going to keep the train rolling. So thank you so much for joining us yet again.
Thanks, Jenna. Always a pleasure. It's just so much fun to do these podcasts.
No, yeah, definitely.
Thanks for having me.
Of course. And so the first question, because, people who have maybe seen the previous episodes just hearing like, oh, you've just talked like this. It's not that it's a hard pivot, but, oh, why professionalism? And so kind of starting first with what is professionalism?
Yeah. I mean, truly, throughout today, we will talk about what is professionalism because everything we talk about is professionalism, but it's truly embodies these qualities of being ethical, working continuously to make sure that you're competent, just always maintaining integrity. And to me, is when you treat people well and you treat them with respect and dignity, that to me is the ultimate key to professionalism. No one is better than anybody. No one is higher than anyone. We are all the same. And when we treat each other well and with respect, I think that is the ultimate, mark of professionalism. But then how do you treat people with respect is what we're going to talk about today.
No, definitely. And kind of also to provide some context so that people kind of know why we wanted to have this conversation. So we will go into depth about, what unprofessionalism looks like, what examples in the dietetics profession, but kind of before we even start with that, why is this important to talk about now?
Yeah, well, we deal with it all the time. We send our site visitors to the universities to visit programs, to make sure that we are watching the quality of the program, the education, that the students are well taken care of. That's the job of ACEND, is to visit all the nutrition and dietetics programs and make sure that they are following the standards and providing quality nutrition education. During those visits, when they're done, we send 2 site visitors, which are volunteers from ACEND, to each program. And then the program director, the faculty, the administration, all of them, and even the reviewers themselves, they rate each reviewer and each site visitor that goes on. And professionalism, hands down, is the biggest complaint we get. It is the one thing that is the hardest to train, but the one that really gets people upset, and we get the most complaints about. So it's very, we think, it's not important, but it is very important, and that what can make a good experience with somebody or a bad experience with someone.
And so thank you for kind of providing that context into why professionalism is something that we need to talk about now in the dietetics profession, because it is an apparent note that's been made just throughout different programs throughout the country as being like, hey, this is something that, yes, it's a soft skill, it's hard to train, but that doesn't make it any less important. And so for those listening in who are current students that maybe are like, oh, I haven't really thought about professionalism, where should I pay attention to it? Which scenarios do you think students, specifically in the dietetics profession, should be paying attention to professionalism?
Yeah, great question, Jenna. But most importantly, I think professionalism fits all professions. But what we can talk about is dietetics profession, because that's what we have experience with. But the first one is being punctual. Being on time is so important. There's nothing that tells somebody that you lack respect for them and their time than you showing up not on time. So that is, I think, the first thing. It's easy to train yourself on it, right? You can give yourself some tips to make sure that you are showing up on time. If you're somebody who's habitually late, maybe show up 15 minutes early to tell yourself the meeting is 15 minutes early or whatever, to make sure that you're on time. Collaborate well. You make sure that you work well with others. You're a teammate. Why collaboration always fits under professionalism? Because it's all about treating people with respect. When you're not collaborating well, you're disrespecting the other people. So you're not giving them the information they need. You are not contributing to the team. All of this, when you don't contribute to the team, you're leaving all the work for the other people to pick up the slack. So that shows lack of respect and lack of professionalism. So make sure you're a good teammate. What are the things that as a faculty I got the most headache from is when we do teamwork and you get 2 or 3 teams that come to complain about one individual not collaborating well. Respect your faculty, respect your other students. How do you respect your faculty? The way you write your emails, the way you are not disruptive. Don't badger them about your grade. Look at the big picture. Is that grade on this one assignment worth badgering a faculty about? Maybe you should have worked a little harder. Maybe you needed to maybe the faculty's trying to tell you that this is not a big area of strength for you. Maybe you need to work on that area of strength. Remember, when faculty are grading you, they're grading you in comparison to everybody in the class. So if you got a lesser grade, that means someone else did a better job. And they're telling you that you can achieve and aspire better. All of these, I mean, I have to tell you stories about students badgering me about grades. And in the end, the students are going to come out with an A no matter what. So, I think it's all about, you feel that it's your pride. And sometimes you have to remember to be humble and put your pride aside to keep professionalism in the forefront. Taking feedback well. That is, when I hire somebody, I'm always going, if we have some constructive feedback for this individual, are they going to be very receptive about it? Because there's nothing worse than giving somebody constructive feedback and them getting offended and coming back at you a little bit offended, and you're trying to really help them out. So, I mean, let me say this better. I'm not trying to help them out. I'm trying to help the team function better. That's always how my feedback to staff is always, how can the staff become a better member of the team? And that's why you see collaborations in a professional work. This is so important because you're always part of a team. People who are not very good professionally cannot work as part of a team, and that's what causes a lot of the issues. And what about making sure email communication is so important? You know, often I am always very careful in how I communicate with email. And as a student, you have to be very careful. I'm not saying to say, good morning, Dr. So and so. You don't have to say that, but always have a little bit, good morning, or hi, how are you doing today? Or if you remember they were traveling, I hope you had a safe trip. Right? Just always, don't capitalize in your email. Don't, all of these things, be very careful. I read my email 2 or 3 times to make sure, how is the tone of that email sounding? Just be careful in every way. It's professionalism is so many things.
Yeah, definitely. And when it kind of goes to first with like, school, like because we are students, the biggest aspect of professionalism that we can start paying attention to is in the classroom, like with what you said, like showing up to class on time, submitting things in on time, communicating. And I really like how you bridge the connection between professionalism isn't just how you carry yourself, it's how it translates into a team effort because there's never going to be a time where you're not working with other people and how you treat others, it comes with being professional and being respectful. And so when it comes to kind of the progression of the becoming a dietitian, like it starts in school. And so would you say that those traits of professionalism translate into dietetic internships and into part-time jobs and interviews as well? Or are there certain things at certain time points that people can be like, ooh, let me pay more attention to this when I'm doing this, or vice versa?
Yeah, absolutely. Like I said, it's the way you carry yourself, it translates to everything. But here's one thing about the part-time job, or the job that you don't care about, or it's not that important, right? Working at a Walgreens or working at McDonald's, all of this, it doesn't matter. You really need to care about the job. That is most important. No matter if it's minimum wage, whatever it is, when you care about doing a good job, when you care about coming up on time, that's when you are being professional, and that's how you should carry yourself. You train yourself to be professional at these part-time jobs and at these small things, because that's how you carry yourself throughout life. Now you asked about the internship. Look, I will share what our preceptors have always complained about. And that's the professionalism piece, is where preceptors always are hard on, and they will ding the student, the intern, about, right? So they're always saying, oh, they're doing great, doing great, doing great. And then in professionalism, I see like, oh, they didn't show up on time. These 2 times they didn't show up on time, or they're regularly late. That is always comes up, always a complaint of the preceptors. You have to show up on time. You have to show up 5 minutes early. That's what you always do. Show up early. It's okay. You can. What is a 10 minute in your life? Just show up early to things. That is a very the first step that you can do. You have to dress respectfully. It is so important that you dress respectfully. I used to always tell my students, make sure that you are dressed professionally when you go to the hospital or to the WIC or whatever. Now, you dress based on the place that you're going to, right? I'm not saying wear a suit. That is not the expectation. These days, you can just wear a nice, a nice even jogger pants that are very dressy. You can find that. You can wear a nice shirt. It could be, a sports shirt, but dressy, elegant, whatever it is for the workplace. It doesn't have to be a tie. It doesn't have to be a suit and tie. It doesn't have to be a suit for uh, female, whatever it is, just something a little bit professional. Some khakis and a polo shirt. That is could be enough. But you also always have to watch what you're wearing. Shoes are always an issue. We get so many complaints about dressing professionally and about the shoes wearing, like flip-flops are just not professional. Always take, let's move in a little bit from the physical. Take responsibilities for your action. If you mess up, just say that was on me, right? Don't hide it. That is the hardest thing for me to learn. And it took me years to get here. But now it's on me, my bad. I've learned to say, that's my bad. That was on me. That's okay. That just saying you're gonna do better next time. That's all people expect. We all make mistakes. Always, when you answer emails, email communication is so important. When somebody sends you an email, don't wait 3 weeks, 2 weeks, 1 week to respond. This is, I tell you, we suffer with this all the time. And that what makes collaboration so difficult. My expectation for my staff is when we get an email, within 48 hours, that email has to be responded. And I set the example. Jenna, when you email me, 24 hours, if not within the hour, I am responding, because that is a show of respect. I'm not going to wait and let you work wait, let you everything you have waiting and wondering what's happening. You are trying to facilitate other people's work. This is how you show respect. And so you respond right away, and you always try to have a little something nice at the beginning. So good to hear from you, all of that, just something nice. And then you respond professionally. And just professionally, doesn't have to say a lot. Just say something that makes sense and respectful. Your preceptors, you always have to treat them with respect. Do your best while you're at the place. Try, read the materials ahead of time if you can. If they give you guidance, if they give you maybe a checklist of things to do, make sure that you read it. Make sure that you follow the directions. Talk to them. Let's stop here. If your preceptor had my name and was a PhD like me, right? What would be the first thing you say? How would you like me to address you? Do you want me to call you doctor or not? Of course, I'm going to say, no, just call me Rayane. You don't have to. That's not an expectation. Second, I'm so sorry. How would you like me to pronounce your name? Right? Because my name is difficult. So you need to ask if you're uncomfortable. Don't go ahead and just pronounce people's names wrong. Ask. Nobody is going to get offended. They're going to appreciate you asking. That again shows a little bit of respect. And I'll tell you, Jenna, all my students, I used to tell them to call me Dr. A, because my name was so difficult. So it is what it is. You just ask people how you want them to treat you, to be treated. And when, of course, we talked about this, but when the preceptor gives you feedback, take it. Tell them thank you. Thank you for the feedback, and don't right away get upset and so offended that how could I not be perfect? None of us are perfect. Know that the preceptor that's giving you constructive feedback is the one that cares. The one that's not giving you any feedback is the one that could care less sometimes. So really, it's that preceptor that cares, that's really putting your good future in mind, is the one who's giving you that constructive feedback. Take it that way. And then tell yourself, how can I improve it? And you that doesn't mean you're not allowed to come back and say, I really was hurt when you mentioned this, and I would like to be better about it. Tell me how I can improve. That is fine to do. It's fine to question some things, but do them in a nice way. Not like, I can't believe you're saying this, and then I am always good, I'm always amazing. That is not the way to behave. And then finally, I said, just read up on the preceptor, read up what they're expecting. Maybe send them an email. I'm so excited for my rotation that's coming. I am very excited. Is there anything you want me to know before I start? I used to even give examples to my interns on emails to send to the preceptor before they show up. Because right there, you're setting that, wow, look at this intern. I'm getting somebody good coming to me. So, lots of little things. There's just so many minute things that you can do that show that professionalism level.
Yeah, definitely. And I'm glad that because I think some people may be listening and there's some of the stuff where they're like, yeah, it's common sense. You just do that. But because I think what can happen is it can seem so common sense that then people forget about it, where maybe it's because it seems like something that maybe will be like, oh yeah, like you just always do that. But then it's maybe when you're in those situations, because you're not paying attention to it, they get like cast to the wayside or things get stressed out. But really just kind of having this episode as that reminder that there are things that are small, but definitely do add up over time. It's like a compound where it's like every good email you send is just like a good little point for you. And it definitely, if you start now as a student, it'll only build up and really benefit you by the time that you are practicing RD. And so we've talked a lot about, just like examples of professionalism in dietetics. Now, I kind of want to flip the coin a little bit and maybe you can share personal anecdotes or just things that you've seen and which you've done a little bit, but examples of unprofessionalism. Like and I think that plays well into the people who may be like, well, yeah, this is common sense. Well, we wouldn't be having this conversation if there weren't points of concern that we've, seen. And so what are some examples or things that students should make an effort not to do regarding being unprofessional?
Yeah, that's lots of examples. I have to tell you, that's the biggest complaint we get. It's the biggest complaints we get with students. I can give so many examples. One time, I gave a student not a good grade, and I remember she was waiting for me outside class when I came in the next day, and she was so upset and screaming that she is not a C student. She is a A student, and just kept being very belligerent about it and very upset. And I tell you, her work was not even the C was generous. So, I mean, in the end, at some point, you have to realize when you're being unprofessional, the other person's gonna respond unprofessionally eventually. I mean, in the end, I said, you're not an A student in my class, period. And I felt it was well deserved. And these are the things you never forget because this is not the kind of person you want to be. But sometimes the person forces you to be that way. Here's one about an intern. I used to always say, everything you do as an intern as a student is not only a reflection on yourself, it's a reflection on the entire program. If a preceptor doesn't like you, all of a sudden, all students from this program are not good enough. And I used to really drill this into my students as much as I could. And dressing professionally was a big one. So I had a student who was a DVA, and yes, and students love being at the VA because the older guys are funny, they're relaxed, they're great patients, they're fun patients, they make a lot of jokes, and so my students always loved to be at the VA because it was just a more fun environment for them, and with the vets, and so and this girl and I one of the things I always tell them, please make sure that you cover up, right? Be careful. Don't show too much skin. Not, anywhere, but at the VA it's even more. But anywhere, just be careful how you dress. And I walked in on my site visit to go to the preceptor to visit the preceptor, and I see my intern, and boy was she showing skin. And I was like, oh no. I mean, I'm sure the clients there, probably some of them had a great time, but I was like, how do I talk to her? She was so unaware of it. This is how she dresses, never thought twice about it. Um, and, we had to have the talk. Like, be careful, because that was just not, I mean, just could think of how the dietitians were perceiving her dress that day. Just don't show a lot of midriff and, you know, cleavage and all of that. Just be very careful how you dress. Um, it's always something to watch out about. The complaints from students about their other students not doing their work. That you put them in teams, and then all of a sudden the student never shows up to the teams, never contribute to the project. They do minimal. And then you're putting, let's say, a C student with an A student, and the poor A student knows that they're going to get a C if that work is going to be doing. So then that A student is working both parts of the project to make sure that they get the A, and then that C student benefits from the A. That gives faculty nightmares. And because that's just not fair. So that's why teamwork sometimes happens, and it's faculty trying to force students to work together so that the A student can work with conflict resolution and how to get that C student to improve. But we know it's not very fair to the students. It's not very fair to that A student. We know it. So, I mean, at the end, what I had to do after stories and stories of students not contributing, I ended up separating the grades. Just say you're doing this part of the project, you're doing this part of the project, and then there's a grade about combining the two. But so I had students would get an A and students would get a C within the same project. And that's the only way I was able to resolve it. Unprofessionals at work, right? When you're an RD, the most important thing is don't dismiss your patient or your client's concerns. They're telling you about something that they are concerned about. Don't be dismissive. How many of us go to the doctor and find the doctor dismisses us, doesn't even listen to us, right? Very, very upsetting. Giving generic advice. Here you got, let's say this individual coming from a different culture, and they eat the different breakfast than cereal, right? And you're not listening to them, or they tell you they hate cereal. You're not listening to them, and you're giving that generic menu. Again, not the way to go. You have to show a little bit more professionalism. Interrupting people when they're speaking. That is very, very disrespectful. And I do have to say, we all do it. I've done it. And I've learned to apologize when I do it. But, I come from a culture that interrupts. So learning not to interrupt has been a very difficult thing. In the US, you're very lucky. You are ingrained at not interrupting people. So hopefully that should be easier for our US-born individuals. But some of us who come from different cultures, we really have to be very careful about interrupting. Gossiping, all right? That is the one that is the hardest to do, to stop and to do. Watch yourself about gossiping. Watch yourself about making fun of people, putting people down. No one is better than anyone. With us, let's say with ACEND, there is no way that I would pull somebody's personal life and talk to another staff member about somebody's life. Or just be very careful about gossiping about clients. When you're gossiping about your patients and clients, right there, you're committing confidential, breach and perhaps something as much as HIPAA violation. Be very careful about gossip. That is the first mark of an unprofessional person. Raising your voice or using disrespectful language, that I have to say, that is terrible. I struggle with that a lot because I was not raised in the US. So the poor language in the US, like the cuss words, don't have a lot of shame meaning for somebody coming who wasn't grown in the US. And so I'm constantly used to tell my kids, you cannot cuss in front of me. And that was my way of teaching them not to cuss. I figured I could do it in two ways. You cannot do it because if you do it in front of your mom's going to start adopting it. It is language so you cannot do it in front of me. So I make sure I do not do these inappropriate words. So just be careful, not the F word every other language you say, or, the other word, just be careful all the words that you're saying. Listen to yourself. I've learned to say darn, and I've learned to say shoot. You know what I mean? These things just to cover up, and not when I'm really angry, not to say some of the words that, just teach yourself not to cuss. Don't miss deadlines, of course. Always respond promptly. If somebody sends me an email and they want something from me and I know I'm way too busy and I cannot give it to them, I will say, how about in 2 weeks? Let's say now, and we're in April, how about would May work? I do respond promptly, but then delay the work. So try to work it that way. Of course, coming late to meetings, we talked about that. All of these things. We have complaints about people not being very hygienic. Watch out for your hygiene. Be careful. You may not smell yourself, but other people smell you. So, hygiene, and it shows. Be very careful with that stuff. That is another example that we've seen. And then the biggest one, I have to tell you, that with Ascend, other than professional dress, is respect. We get sometimes some volunteers that tell us that the other volunteer was not very respectful to them. So they did not listen to their feedback. They were not respectful. They did not treat them. They felt like they are better than the other volunteer. Again, I say we are all equal. No one is better than anyone. No matter what great position you have, you are still a human being, and everybody deserves the respect and to be treated, that their opinion matters, and what they say matters. So all of these are examples that we've struggled with.
Yeah, and I'm glad that you've showed examples like all the way from students to like practicing dietitians, because it's not like professionalism stops once you get the credential. It's always going to be an ongoing thing that you even shared your own personal experience with improving. And really, the theme that I've been hearing is like self-awareness and just knowing yourself so that you know like what's, because you've given a really good bullet list of like things that are professional, things that are unprofessional. And I think for the people listening in, there are going to be certain bullet points where you're like, yeah, no, I'm good with that. But then, we may have gone through a note where they're like, oh, like maybe they're like, I never thought of that. And so even, like even the people listening in that may just be hearing these bullet points, like actually really digest the things that have been said so that you can really be honest with yourself and self-aware of, is this a problem? Because you mentioned like pride tends to be the thing that drives a lot of these kind of rash emotional responses that become unprofessional. But if you're aware of what you need to work on and you are aware of your pride, because also similarly to everyone being human and everyone making mistakes, everyone does have some level of pride. And so being aware of that, that's really the first step. And then I think kind of moving in towards professionalism doesn't necessarily, of course, come naturally because you'll have to put effort into it. But I mean, similarly to what we say in nutrition counseling, the first step is awareness. Um, so as far as then looking into, because we kind of provided context into like, oh, why talk about professionalism now? Can you also kind of describe the evolution of professionalism? Like how has it changed? Like we have noted how the things that are a problem in the present, but how was it before and how has it changed now from what you've seen?
Yeah, of course, it's changed a lot. I mean, look at how the dress has changed. Look at how people change. For example, I will tell you when I was a student, if you come late to class, the door would be closed and you're not allowed to walk in anymore. And the faculty will close that door. If the class is at 8 o'clock, it was 8 o'clock, and they close that door, and you're done, right? Um, people that you had to always be professionally dressed, suits, ties, women dresses, heels, everywhere. Like every day we went to work, that's how we dressed up. And now people go to work in jeans. People go to, a lot much more relaxed. You never sent an email to your faculty as long and you didn't say, dear Dr. So and so. Or even when you see them or when you refer to them, you called your faculty by doctor. You were never. I used to have a faculty who the first time he walks into class, he would put, my name, you can refer to me as Dr. So and so and so. That is my name. I did not get my PhD, so you can call me anything else. I mean, could you imagine somebody saying that now? I mean, I have my kids now asking me, Mom, can I call, this is my doctor faculty. Can I just call them by their first name? And I'm like, please don't. Ask them if they want to be called by their first name. You know, so now students are like, oh, I should be calling somebody by their first name. Well, maybe you should just say, would you prefer that I call you doctor or by your first name? Ask your faculty. That's how things have changed over time because things have become so relaxed. I hear students tell the faculty, oh, I don't feel like working on this project. I would much rather work on this. Do you think we had a choice on working on a project? We had zero choice. We're like, this is your project, go do it. And you couldn't complain. We couldn't complain before. Now complaints, like students are, it's encouraged to get feedback. All of the things have changed and they have moved so far lately. It's just been going from very, very formal to much more relaxed. To, and there's been this view of the decline in professionalism. We'll talk a little bit later, Jenna, that I don't think it's a decline in professionalism. I think having a relaxed atmosphere can still be hand in hand with being professional. Has nothing to do with being unprofessional. But I just want to give you some statistics, just so that you can look at what's happened in the workforce and in the two generations, probably the baby boomers and the Gen Zers, and that clash of generations, is that there's been articles in 2024 that talked about how the companies are firing Gen Z employees. And many of these articles, in one of them, says that out of 906 businesses that were surveyed, that fired almost 30% of their Gen Z employees. 46% of these businesses cited lack of professionalism as one of the reasons for this rapid firing after COVID. And this just tells you, and what did they mention about that? They said that the workers did not act professionally, they were not coming on time, they were not dressing professionally, and most importantly, within 2 months of going on the job, they were asking for raises and to be promoted to leadership. And of course, you need time. You cannot. It is so funny. I work with people all the time, and they're like, well, and I know somebody just yesterday I was working with, they took a job about a month ago. And they're like, well, yeah, I should talk about a raise. And I'm going, what the heck? You really need to wait a year.
Yeah, and I really appreciate you kind of describing not only how it's prevalent in dietetics today, but also giving further context into the evolution and how, yes, there can be a balance to things, how we went from things being incredibly formal to just swinging all the way to the right. And I like how you express the nuance where you can be in a relaxed environment, but still be professional. But I think that's, again, it paints a picture as to why this episode is so important, because I believe with having more relaxed environments, the common sense that came with professionalism is kind of getting a little slipped away, but it's good to realign and be like, you can have both coexist together. And so, kind of further narrowing in on, we've provided really great examples of what is professionalism, what is unprofessionalism, but really getting into the nitty-gritty of what would draw the line between someone who is considered professional and someone who's considered unprofessional, because people can have little traits of each, but what would make someone labeled as one or the other?
Yeah, it is really, I mean, like we said, there are nuances, but it is really the accumulation of things, right? Everybody makes mistakes. Making one mistake does not make you unprofessional. It's that accumulation of too many things, right? That's what can lead to somebody going, well, this person is lacking professionalism, being late all the time, not dressing appropriately all the time, not being respectful, But if you are respectful 90% of the time and you slip once, we're all allowed to slip. And the hardest thing is to apologize for the slip. That has been, I worked very hard on myself. Sometimes I wait a day to work on myself to apologize. And I call the person and say, I apologized. I was out of line yesterday. I've done that before. Hardest thing, but boy, do you feel good once you've done it. But like we talked about the nuances that we can be very relaxed, yet still professional. And there are these small nuances about the difference, what makes somebody professional. Uh, it becomes ingrained in you. Jenna, let's talk about this morning, right? We are giving this talk, and I want, out of respect for you and for our students, what did I do? I fixed my hair, right? I usually don't fix my hair. I'm usually, because I work from home, right? Usually I wear my North Face all day in, day out, right? I have a collection of colors and I'm in them in and out, right? I put a shirt on and I thought about my shirt and I opened the button. I'm like, oh, that's too open. I closed my button back on. I added a necklace that I normally don't wear, right? The makeup is vanity. So the makeup is not has nothing to do with professionalism. But all of this is just ingrained in you on how you dress. I even thought of, should I put a scarf? And I'm like, no, this is fine. You know, everything, everything you do is part of being a professional. So just learn these things. They're little. Think of the nuances that I did. I opened my button and I'm like, oh, I think that's a little too low, and I went and closed it. That's a nuance. That's a tiny little thing that adding that little necklace. I'm sure nobody noticed it, but to me, these little nuances add to the professional. In your email, good morning, remembering somebody was on a trip. I hope you had a safe flight, right? You remembered, you heard that I have a trip and I've been traveling a little bit. The first thing you saw me today, you asked me about that. All of those things are the little things that add to the professionalism. When I am 1 minute late, literally, sometimes I'm late from meeting to meeting, I'm 1 to 2 minutes late to a meeting. First thing I do, I apologize. I'm late. And people go, oh my God, we didn't notice. It doesn't matter. I noticed. These are the things you start with the small things and then you build on them.
Absolutely. And I also wanted to note that when we started our meeting, I did notice, I was like, her hair looks really nice. And I did notice your necklace. And so it did not go unnoticed. So when you mentioned it, I was like, yeah, no, you're so right. It is the little things. But yeah. And I'm not just saying that because you mentioned it, but it is like those tiny things, they do add up where it's like, yes, we are presenting ourselves because we want people to have a good, positive, respectful experience. And how again, it's yes, notice the nuance, but also, yeah, don't beat yourself up because you mentioned when you apologize, the payout for apologizing, you just have this huge weight off of your shoulders. And instead of just having this thing gnawing at you of like, I messed up. What can I do? It's you address it and move on. But you move on, not forgetting that it happened, but you just move on knowing that you will do better next time. And again, it is the compound of the good things outweighing those little slip ups that you have now. And typically, the more that you beat yourself up, the more that you disregard the improvement, and then you just focus on how much you've messed up. And so, definitely, like, yes, being super aware of the nuances can appear or sound overwhelming, but really, it's just a habit that you have to build. And then it really does become second nature. And then it's really like it is an overall positive thing to add into, yeah. But
Jenna, yeah, can I just, you just made me remember this. Don't beat yourself down. Self-reflect. Always use reflection, right? This is why your faculty constantly are asking you to self-reflect and giving you this assignment. But do a self-reflection, but don't beat yourself down, because people notice improvements. One time I had a course and I had a student that was really unprofessional and did not do well in my course. And I had a really poor image of her. And the next year she completely changed. And I went to her and I said how much I see the change and how proud I am of the change that she did. People notice the change. Just you are hardest on yourself. Just improve yourself. That's all that people are asking. And you make a mistake once, forget it. Forget it. Just make sure that you improve it next time. And you can improve it bit of it. I cannot tell you how hard I worked on myself not to interrupt people, and I still struggle with it. But I am 1,000 times better now than I was when I first came to the US. So it will take a lifetime, but trust me, you appreciate it and people appreciate it and they will notice.
Absolutely. And I think that this really segues well into the last thing that we really want to kind of send students off with is how can they start incorporating professionalism into their lives today? Because you mentioned how it is a lifetime of improvement, and starting earlier is really the best way to make the most out of not just being like professional, checking all the boxes, but finding what professionalism is uniquely for you, because also everyone's different. So everyone has professionalism portrayed in a different way. But bottom line, it's that respect, it's that communication, it's that being interpersonal. But for those who are listening to this and they're like, okay, how can I take the steps today, tomorrow to start being professional, what advice would you have for them?
Yeah, absolutely. Start with the small, with the easy things. It's just like behavior change, right? It is behavior change. We should be the expert at it. Just start at those little small steps. Punctuality, right? Go online, go on YouTube, figure out how do you make yourself more punctual. Set your alarm clock an hour early, whatever, sleep later, all of these things, right? Make it a mindset of being punctual. Then, and so that's then your emails. Give yourself time to write those emails, read them again. Those are simple things that you can do. Your dress, please don't go buy new clothes. You know, just very minimal. You have everything at home. These days, wearing sneakers is no big deal. You can wear sneakers. Just wear your sneakers. Just don't come with flip-flops to a professional meeting, right? That's just minute things. Those you can do, and you can go on YouTube and you can learn yourself. The other things, use self-reflection. Uh, Try to work on yourself slow by slow. Where did you feel you didn't do well? See if you can do well next time. Take the feedback from your faculty and your preceptors. They're telling you something. They're, especially if it's consistent. That means you're doing something they're noticing. And 1 out of 5 are going to tell you to your face. The rest are going to complain about you, which is not professional. There's you go. But there's also a lot of help out there. You have articles, free courses. You can go on the MOOC, take some of these free courses online. There's tons of stuff. You can look at Coursera. You can do edX meeting. You can do Udemy. All of these. There's tons of these courses out there. Professionalism is huge. Uh, if you feel like you need a lot of help, maybe join a professional organization, a network group. There's so much out there. You can also take free leadership courses. There's not one leadership course that does not talk about professionalism. Uh, get some books. Maybe ask at one of the holidays for somebody to get at your birthday, somebody to buy you a book on it. I bought my kids, there's a book that a faculty in dietetics said, it's on how do you act as a graduate student. I thought that was so good. When both my kids became graduate students, I gave them the book. And I know in that book, some of the points could really be helpful to them because it was about how do you take feedback when you have conflict with your advisor? How do you address the advisor? There are books out there that you can really use. And so ask them for a gift. And ACEND also, we on the program director side, part of our website, or the preceptor part of our website, the practitioner, we have leadership courses. They're all free. And they're not from dietetics. They're from all over that have been vetted, that have been reviewed, and they've been deemed strong leadership courses. You can take those. So there's a lot of help out there. I really highly recommend you can access the help you have.
No, yeah, definitely. And I think it's again, like having the self-awareness, knowing, like what things that you could improve on, but not beating yourself up about it, and then going out and seeing how you can improve. And I think one thing, like for me personally, one thing that I noticed was how dress. And it's not that I ever dressed like in my pajamas going to work, but it was definitely that, like when you mentioned the relaxed environment kind of bleeding into relaxed everything else. For me, it's like I'm not going to go to, the store and start buying $50, $100 clothes or anything. It could just be going to Goodwill and seeing what nice clothes that they have. Like it could be like if you want to go get book resources, there's thrift books online where you can order books from there. You can again go to thrift stores or ask it for gifts. Like there's a lot of ways to not correct, but just to improve professionalism and it not having to be this huge monetary investment. Really it's just that investment in yourself more than anything else. But is there any last things that you wanted to mention or any
Yeah, no, Jenna, you just said go online and look at images and just put images of professional dress versus unprofessional dress,
Mhm.
right? Go online and maybe use AI to put your email in and say make it more professional. So easy to do. There are just so many tips you can do, you can have. But no, I hope that our listeners out there take something positive from this, and know that it's all for the better, and it's for their own improvement. And thank you so much for letting me talk about this, because I tell you, we struggle with professionalism the most.
Absolutely. I'm sure listeners will glean at least one positive thing from this, and it's absolutely coming from the realm of positive improvement rather than we're doing such a bad job, we're doing such a bad job. No, it's just 100% a readjustment of course rather than a beratement or anything. So yeah, absolutely. Very positive conversation. Thank you so much, Dr. AbuSabha, for joining us yet again. And we will be having another episode covering the interview process and interviewing skills. And so professionalism was a good like kind of preview to that, because you have to have a strong foundation of professionalism when you go into those interviews. But we're going to dive really deeper into how to be a good interviewee when you go through those interviews. So thank you again.
And thanks so much, Jenna. It was always a pleasure.